Hello, everyone. My name is Helene Alvarez, and today's topic presentation will be on adolescent pregnancy for our human development class with Professor Lindsay for the fall 2018 term. I will be discussing home-based intervention strategies as well as school-based intervention strategies that could be used to prevent teen pregnancy in the future. Adolescent pregnancy is defined as women who become pregnant between the ages of 13 and 19. The term is often associated with females who have not legally reached adulthood who become pregnant. In 2017, adolescent pregnancy hit a record low birth rate of 18.8 per 1,000 females between the ages of 15 and 19 years of age. Highly significant considering that, let's say a little bit over a decade ago, it was the contrary, where we saw a spike in adolescent birth rates, whereas now we've seen the steady decline. It is believed that sex education programs, abstinence, and contraceptive use are active preventative factors. While a plethora of factors exist, we will be discussing the following: peer pressure, family-related problems, sexual desire, curiosity, sexual partners not using contraceptives or using them incorrectly, as well as body image. Body dissatisfaction during pregnancy is a concern because of the potential association with negative behavior, such as that unhealthy dieting, which has been linked to poor pregnancy outcome with impacts to one's quality of life. In addition, we should also consider a person's self-outlook, parents' level of education, race, and ethnic background. In recent studies, it's been said that fertility rates among non-Hispanic females were slightly lower compared to Hispanic females. This population is often associated with lower education attainment, financial dependence on others, and increased poverty. Why are teens at risk? Cognitively, teen mothers are in jeopardy psychologically because they experience high levels of stress, despair, depression, feelings of helplessness, low self-esteem, and a sense of failure. In terms of educational attainment, half of teen mothers don't graduate from high school. Parenthood is also the leading cause of school dropout among teens. Financial independence, financial security, lack of parental support. As we continue to move forward with our programs as well as place this in practice, we need to be aware of what factors are contributing to teens' sexual activity or why they are so curious to know what happens next. What I would recommend is at-home intervention. As parents, we need to be able to communicate with our child about sex, discuss all contraceptives available, ensure that there's not just one type of contraceptive that works for everyone, make them aware that there are multitude of contraceptives available to help them and help them understand what sexual desire is and possibly encourage abstinence. What we want to do at home is make sex not taboo. We want to make it a common conversation, as, as well with boundaries, of course, but we want to make everyone feel comfortable and be willing to share what is really going on. School-based intervention strategies are, as a school counselor, we need to be able to practice a solutions-focused approach by promoting reproductive health and teen pregnancy. We also need to develop culturally and developmentally appropriate interventions to address each age group as well as each ethnic background. We also need to encourage open communication between sexual partners to foster self-awareness of potential outcomes. We can say that students aren't aware of what can lead to pregnancy, but that's also a miscommunication and a misunderstanding on behalf of the teens. If they're not talking about it at home, then what do they really have to go on? If the parents are telling them that's not something we discussed, and then school is only engaging them in their education, then that's where we're faltering. In order to have an effective health reproductive program on school sites, it's recommended that the six strategies are completed, that the school nurse, as well as administrators, participate in sex education courses, that there's on site reproductive services or through the local county health office is offering self awareness classes or child development classes to teen parents. We also need to foster positive school connectedness to all students. We need to encourage self-efficacy and self-esteem, provide ample mental health and social services access, as well as promote parent-adolescent education workshops to promote self-expression. Next, we will consider the effectiveness of school-based interventions. We will be discussing negative implementation as well as positive implementation. In establishing a poor school-based intervention, they're addressing the following. There's a lack of funding and there's poor curriculum application that happens. There's poor community connectedness. There's a lack of community resources and referrals, and there's lack of supportive leadership, meaning that the school counselor, as well as who's on her team, is not getting the proper support that she needs. There's not much there. So she's one person or two in a lonely area, not really getting the direction and support that she needs. In creating a positive implementation, there's ample funding because leadership recognizes your efforts as well as your dedication and is able to make a connection between the data that you provide in post and pre-op surveys to the families that attend some of the community forums. You engage in education activities that are fulfilling and helpful to the students, and you also engage in open communication with everyone. In addition, you're also promoting a stable caregiving environment at school and at home so that the children, when they leave with something positive. They leave with a stable area of where they can go to and receive information. As school counselors, what we also need to do is we need to help them rebuild reputations so that they can feel included. Adolescents focus on self-image. They want to be different, but yet the same. Peer recognition is the primary objective. Reputation is so important. Negative and positive traits are part of one's reputation. We need to be able to understand how one's reputation can be perceived at home, family, and at school. So most of these kids that go to school and are teen parents, they suffer thus. As school counselors, we need to make our space inviting and helpful to them so that they can engage in positive interactions with their peers, with others like them, and possibly refer them to services that will be helpful for them in the future.